Cholecystitis is a medical condition characterized by inflammation of the gallbladder, a small pear-shaped organ located beneath the liver. The gallbladder plays a vital role in digestion by storing and concentrating bile, a digestive fluid produced by the liver. When this organ becomes inflamed, it can cause a range of uncomfortable and sometimes severe symptoms. In many cases, cholecystitis is caused by gallstones, but other factors can contribute to its development. Understanding the symptoms and knowing which foods can exacerbate the condition is essential for managing it effectively. Cholecystitis refers to the inflammation of the gallbladder, which can be acute, sudden and severe, or chronic, long-term and recurring. The most common cause is a blockage of the cystic duct by gallstones, a condition known as calculous cholecystitis. Less commonly, the inflammation occurs without stones, a condition referred to as acalculous cholecystitis. This variant is often associated with critical illness, trauma, or infection. Gallstones are hardened deposits of digestive fluid that form in the gallbladder. When a stone blocks the cystic duct, bile builds up, leading to irritation and inflammation. Tumors may block the flow of bile, leading to a buildup that can cause cholecystitis. Scarring or narrowing of the bile ducts can cause a blockage, resulting in inflammation. Certain viral infections, such as hepatitis or HIV, can contribute to gallbladder inflammation. Reduced blood flow to the gallbladder, especially in critically ill patients, can result in cholecystitis. Cholecystitis presents a range of symptoms, some of which may mimic other digestive disorders. Common symptoms include abdominal pain, usually occurs in the upper right or center of the abdomen, can be severe and steady, often lasting for several hours, may radiate to the right shoulder or back, tenderness over the gallbladder. Pressing on the upper right abdomen may cause significant discomfort, fever and chills, an indication of inflammation or infection in the gallbladder, nausea and vomiting. Often accompanies pain and is a common response to gallbladder inflammation, bloating, abdominal distension due to impaired digestion, jaundice, yellowing of the skin or eyes may occur if the bile ducts are also obstructed. Fatty food intolerance. People with cholecystitis may feel worse after consuming greasy or fried foods. Certain foods can trigger or worsen gallbladder inflammation, especially in people who are already susceptible due to gallstones or previous episodes. These foods typically increase bile production or contain unhealthy fats, which can overwork the gallbladder. High-fat foods. Fried foods like fried chicken and French fries. Fatty cuts of meat such as pork belly and sausages. Full-fat dairy, including whole milk, cheese and butter. Fast food. These foods require more bile to digest, putting pressure on the gallbladder and potentially leading to an attack. Processed foods. Chips, cookies, pastries, refined grains like white bread, foods high in trans fats. They can cause inflammation throughout the digestive system, including the gallbladder. Sugary foods, soda, candy, desserts, high sugar diets contribute to obesity and insulin resistance, both risk factors for gallstones. Eggs, in some cases. For some individuals with gallbladder disease, eggs can trigger pain. Spicy foods can cause gastrointestinal distress and may exacerbate gallbladder symptoms in sensitive individuals. Caffeinated and carbonated beverages, coffee, energy drinks, and soda can stimulate bile production and aggravate symptoms. To prevent flare-ups and manage symptoms, patients are advised to follow a low-fat, high-fiber diet. Recommended foods include lean proteins like chicken breast, fish, tofu, and legumes. Whole grains such as oats, brown rice, and whole wheat. Vegetables like leafy greens, broccoli, and carrots. Fruits including apples, berries, and bananas. Healthy fats in moderation such as olive oil, avocados, and nuts. If left untreated, cholecystitis can lead to serious complications such as gallbladder rupture, abscess formation, peritonitis, which is an infection of the abdominal lining, sepsis, pancreatitis, biliary cirrhosis. Early diagnosis and appropriate treatment are crucial to avoid these outcomes. Doctors typically use a combination of the following to diagnose cholecystitis: physical exam, checking for tenderness in the upper right abdomen, blood tests, elevated white blood cell count or liver enzymes, ultrasound, most common and non-invasive imaging method. HIDA scan tracks bile movement through the biliary system. CT or MRI scans offer detailed imaging if needed. Treatment depends on the severity of the condition. Hospitalization, intravenous fluids and antibiotics are given to manage infection and inflammation. Fasting, avoiding food to allow the gallbladder to rest. Pain management, medications to relieve discomfort. Surgery, cholecystectomy or the surgical removal of the gallbladder is the most common treatment for recurrent or severe cholecystitis. It can be done laparoscopically or via open surgery. Maintain a healthy weight, avoid rapid weight loss, eat small, frequent meals. Stay active and exercise regularly, limit intake of saturated fats. Stay hydrated. Cholecystitis is a potentially serious condition that arises due to inflammation of the gallbladder, most commonly caused by gallstones. Recognizing the symptoms, such as upper abdominal pain, nausea and fever, is critical for early diagnosis and treatment. Equally important is the role of diet in either aggravating or alleviating the condition. Individuals with cholecystitis should avoid high-fat, processed and sugary foods while adopting a gallbladder-friendly diet rich in fiber and healthy fats. With proper medical care and dietary adjustments, cholecystitis can be effectively managed and complications can be minimized or prevented.